Dr. Rodman, between all the different lifts, deep plane facelift and mini facelift, how does the patient know which one they need?
So the patient doesn't necessarily need to know in advance what kind of lift they need. The doctor needs to know what kind of lift they need. So a consult with the patient should involve the doctor explaining what kind of lift they think will address the patient's concerns, and then explaining what that procedure involves. Now, mini lift, short scar lift, SMAS lift, deep plane lift, I have found that that means different things to different doctors. It means different things on different websites. And so what I would really encourage patients to do is to come to a doctor and instead of saying, I want a deep plane facelift, say, I dislike my jowls, I dislike my sagging neck. Tell them what your problem is. The surgeon, or at least what I try to do, is I try to listen to the patients, hear what they don't like, and then create a solution for them. Sometimes that's a deep plane facelift, sometimes it may just be a mini lift. It really depends on the patient, depends on their needs. And then what they call it doesn't really matter. People have trademark names that they call their lifts, other people just call it all a facelift. It doesn't matter what your doctor calls it. What matters is that the doctor should be able to explain to you what procedure they're going to do, what's involved, what's the recovery, what are the risks, and what are the outcomes that you can expect. So my point is don't get too caught up in terms because everybody's calling different things different terms. What you want is to describe your problem, and you want a surgeon that can explain the solution to you and explain what's involved with the procedure. And if you feel comfortable with that and you are able to see some of their other results of a similar procedure, you should move forward.